So before I start my main presentation, I'd like to talk about a brief overview of my research and what I do in the recent research projects. So my research interest is in the theoretical and computational aspects of operations research with application in healthcare and service systems more broadly. So I've done some work in healthcare operations management, improving the service quality for emergency medical service systems through optimization of their daily operation, locating ambulances, relocating them as they become busy with the service, and how to combine that with their dispatching policy. And the goal is to minimize the response time, improve the service quality, and save more lives. As Mitch mentioned, I've done some work in infectious disease modeling, and this work has started before the COVID. We've done some work on how to distribute optimally the flu vaccine in a heterogeneous population when people have different vulnerability, infectiousness, and there you have the limited available vaccine. You want to contain the outbreak. But then also the most important thing is how you want to be equitable, because the vaccine is limited. You want to contain the outbreak, but then this doesn't always agree with the equity aspect. So this was before the COVID-19 pandemic, and it turned out to be very relevant these days. And we are working on extending this work to a sudden outbreak like COVID, where there is no vaccine for a while, and then how we could actually make better decisions to contain the outbreak in combination with non-pharmaceutical interventions such as social distancing, hand washing, closing the schools, etc. I've also done some work in supply chain network design. In collaboration with Dr. Lee and Dr. Campbell in our department, I've done some work in distributing vaccine using drone in less developed countries, with a specific case of Vanuatu, which is a South Pacific island country, including isolated islands with minimal infrastructure for the transportation. And the idea is how we could actually exploit the usage of drone to allocate the vaccine in those remote areas. And the vaccine was initially the children vaccinations. And but this work is obviously extendable to the COVID-19. And also when it comes to distributing the vaccine, I'd like just to explain a little about that. Is the vaccine has to be maintained in a certain temperature when it's being transported, which imposes additional restriction for the distribution decisions. And also that is called the cold chain limitation. And also when you're using the drone, then the drone flight range is limited. And then there is a need to consider whether the drone needs to be recharged along the way as it's distributing the vaccine. Then it comes to a more strategic decision on, okay, if you need to recharge a drone, then you need a relay station, then how you want to locate those relay stations. And the goal is to minimize the total transportation cost, use the drone in combination with other transportation modes like truck, boat, plane, when they are available. So this work was funded by ASCM, and we've been working on this and continuing to work. Lastly, I have been working on reliable supply network design, considering customer preference orders. And for the rest of my presentation, I'm going to talk about this work because I think it's the most interesting and probably the most relevant for this audience. I'm hesitating to and refusing to go with my healthcare instinct for today. So traditionally, for the facility location allocation problem, so there is a central planner that would want to locate perfectly reliable facilities and then allocate customers to those facilities in order to minimize the total cost of opening the facilities and also the cost of assigning the customers to those facilities. But then, as we are all convinced by the great presentation of Andrea and Joya, well, that's not the reality. So the facilities are not perfectly reliable. There is always a chance of failure. And then there would be a work of risk assessment and then predicting those chances of failure. But then what I'm going to present is how we could actually incorporate that failure probability into the decision-making process of that central planner and locate and allocate the customers that way. And then I don't really need to explain this, that what are those sources of reliability? We are all convinced, I guess. So in addition to the reliability problem, that is one aspect of the reality. The other thing is, if you're having a central planner, then the choice that the central planner would make to allocate the customers to the facilities may not necessarily coincide with the choice of customers. Then if that's the case, then how you want to actually locate the facilities and incorporate the cost of opening the facilities and the service assignment, but then since the customers have their strict preference, then how you want to make sure that the disutility as well is being minimized. And the disutility incurs if there is no preferred facility open for a customer, then that means no service, and that incurs additional cost. So I'm going to talk about an optimization model that is bridging the gap between those traditional models that only consider the customer preference as an option, and also those that are only considering the reliability of facilities. So I'm considering both into the decision-making process. So the assumption is that if the facility becomes unavailable, then the customer would choose the next most preferred facility, and if there is no preferred facility available, then there's a disutility. So application for this problem is, I just stated the problem very generally, but then one important application of this problem is a supplier selection problem. So in the supplier selection problem, you have a firm, which is the central planner in this problem. And then the firm wants to decide about choosing a set of suppliers for meeting the raw material requirement for their production plants. And the production plants in this case in the network are the customers. And then the upstream supply chain, as we heard in the previous presentation, is subject to different sources of reliability. So there's a chance of failure due to the tariffs that could happen, or the lack of raw material availability, and all other aspects, like what happened with the US pharmaceutical industry. We've heard, I had this example, but this is great that the stage is all set for me. I don't really need to explain that. So the raw material for the pharmaceutical company were heavily impacted by the tariffs first, and then the COVID-19 pandemic. And then each production plant in this problem may have their strict preference for a supplier depending on the quality of the raw material, depending on the delivery speed, and etc., or the domestic stability and everything else. Then the idea is the model is going to help the central planner, which is a firm, to incorporate this utility and come up with the most resilient and cost-effective contractual agreement with some of those backup suppliers in order to incorporate that reliability issue, the customer preference, which are the production plants, and then consider the fixed cost of establishing those contractual agreement with the supplier, as well as the cost of procurement from each supplier, which is essentially the cost of assigning the customer to the supplier. So another application in the service system is the public health service network design problem. So in this context, you can think about the residents in a region that are usually using the public service networks that are provided. And the public service face disruption risk, and they may stop providing the service, for example, due to the inadequate funds that they might have. For example, consider redesigning the senior community centers, and these centers provide different services to the older citizens, for example, meals, transportation, health promotion programs, legal advice, and all other services. So depending on the programs and the services they provide, the seniors could have their own preference to use a center, then that is something that the central planner has no control on. And then they would choose the center based on the preference, and if there's no preferred center available, then they would not seek service, and that means no service and disutility in the system. So this is an example of this problem before I talk about the model. So in this small example, we have 5 candidate facilities to open, shown in squares from A to E. And there are 3 customers, 1, 2, 3. And then there are solid and dashed lines showing the linkage to from every customer to every potential facility. And then here we are considering 3 maximum levels for the maximum number of backup facilities considered by a customer. And then here is showing in the table below, it shows what is the customer preference for every customer. For example, customer 1 would choose first facility C if it's open, then B, and then A. And then if you pay attention, all of them at the last backup level are linked to a dummy facility, which is a way to represent this utility. This facility does not exist. If they have to seek service from dummy facility, that means this utility. So the model is, in this feasible solution, is opening facilities B and D, as shown in green. And then you see the black, dark gray, and light gray showing the first, second, and third backup connections, respectively. So you would see that in the solution on the right in the table, the customer 1, for example, in the first level would seek service from facility B, which is originally in the preference order is the second choice, but then since it's the only one that is open, that would be the first level. And then if it happens that facility fails or that contractual relationship fails, then that would be a disutility because there no other preferred facility is open in this example. So this is just to show you the structure of the problem. So I'm not going to go into the detail of mathematical expressions, just to give you an idea of what are those inputs that go into the model. So we have a set of customers, or you can think about them as customer groups. And then we have a set of candidate facilities, the set of backup levels, and obviously we have the customer preference order for every customer or every customer group. And then we have the probability that a facility fails. This is what comes from the research of Andrea and Joya. So that's a job of predictive, to do the risk assessment and give a value to the optimization model that what is the chance of failure for this facility. And then there's a fixed cost of opening, and there's a cost of serving each customer. And then and also we are having a maximum number of backups considered as a given value for our decision-making process. So what are the decisions? So for the central planner, the decision is what facilities to open, and then what facilities is used by each customer at each backup level, and finally, what's the chance that each customer would seek service at a certain backup level? That's also a decision. And I'm going to explain how that is calculated. So the objective is to minimize the total cost, and the cost is the cost of opening new facilities and the cost of providing service to the customers. And the constraints or the limitations and the requirements for the scope of this problem is you want to only open facilities in order of their preference, and you want to consider and you want to assign the customers based on their preference, and every facility, it can only appear as one certain backup level, cannot appear more than once. And the customers would always choose the dummy at last to just represent this utility. And finally, we have a set of constraints to calculate the chance that the customer would seek service at a certain facility at a certain backup level. And that is calculated based on the chance that a facility is assigned to a customer, and also the chance that the failure probability is happening. And that makes the problem, the model, nonlinear, which is a difficult one. So we had to reformulate the model, make it linear, and develop some solution methods to deal with the computational tractability. I'm not going to bore you with that. So I just want to show you the solution configuration as some of those key parameters change. So what is the output of this problem? So what can we get? So here is an instance of 50 customers, 20 facilities, 10 backup levels. And in the base case, there are 20 facilities, and I'm showing the first 2 backup assignments and what facilities are open. So the facilities that are open are having a bar. So in this base case, all the probabilities, failure probabilities are below 10%. The chance of failure is low. Then we increase the failure probability for those most frequently facilities, 12 and 19, shown in red bars. So these are the facilities that are most frequently used. And then we are examining 2 scenarios. One, it happens that these most frequently suppliers, for example, you can think about, they become suddenly unreliable, and the chance of failure increases after that initial planning. Then what would be the outcome of the model? As you see, the first scenario, all the failure probability in this case is less than the chance of flipping a coin, less than 50%. Then you'll see that as a result of this increase, more facilities are being open, and then there are less number of customers assigned to those less reliable facilities that used to be frequently assigned to the customer. And then when we increase the failure probability to more than 95%, meaning very likely to fail, then we'll see that those very most frequently used facilities are not being open at all, just to make sure that we are minimizing the disutility cost, because it's becoming very expensive. So just to show you the solution configuration as expected. And another parameter that I wanted to show you is the disutility cost. The disutility cost is something that the central planner should have a perception on. It's essentially something that you would perceive as, what is it? What is the value of this utility? What is it that you want to know? So is it, are you planning to be very conservative? You care that no disutility happens, no one goes without service, then you are assigning a larger number. Then as you see here, as the disutility cost is increasing, you would, if it is more expensive to have no service, then the number of open facilities, as you see on that line, is increasing, which is expected. And also the trend for the disutility cost is also non-decreasing, depending on the disutility cost, because you want to minimize the likelihood of incurring that expensive disutility cost. So remember, the model did take into consideration the customer preferences, however, did not accommodate them. So in this model, we did not really open the facilities based on the customer preferences. We just take into consideration they have their own preferences. So what if we want to accommodate that? We want to accommodate the preferences of the production plants, for example. Then what that means in reality, it's possible that the customer might be willing to pay a premium fee, or that accommodation of the most preferred facility could translate into some utility or reward for the central planner. Example, in the supplier selection problem, the firm may see it valuable to go after the best suppliers that the production plants would prefer, because that would later on would translate into waste reduction, on time deliveries, etc. So in that case, that utility would justify the additional total cost that might happen in case of going after those most preferred facilities and enforcing that. In the senior community center, you can think about the government, the county officials who are responsible for this network design. They may subsidize some of these services for those areas that they know is very popular and the most preferred, or the users, the senior citizens, they may be willing to pay some premium service fees to actually make sure that they have their facilities that are preferred open. So in order to accommodate that, we have a constraint to ensure, we add that constraint to the problem to ensure that one of the certain number of most preferred facilities that we show here by K would be open for alpha portion of the customers. So make sure that at a certain portion of the customers would be definitely assigned to their preferred facility, and that means that you need to have that facility open. Then okay. So this is showing a numerical experiment on an instance here. So I show considering k equal 2 or 3, the number of most preferred facilities, and the alpha shows the proportion of customers that we want to make sure they would have their most preferred facility open. So we are considering 75% or 100%. Then the total cost I show here is divided into facility opening cost and service cost. So the first bar here shows the original optimal solution without accommodating the customer preferences. So what you observe is there is an increase in the total cost as we try to accommodate the customer preferences, and as we have less number of facilities, so as we have a smaller number of K, the less number of most preferred facility, you want to make sure the 2 most preferred facilities must be open for a larger portion of customers. When alpha is greater, then the increase in the total cost is more. So for example, in the last bar to the right, when k is equal to alpha is 1, that means we want to make sure the 2 most preferred facilities are open, and 100% for the 100% of customers, for all of them. Then that is resulting in 44% increase in total cost. That's what we could get from this model. And one last thing I want to talk about is the concept of equity, but I'll go quicker. I see the look on Mitch. I'm like, I'm gonna go quicker over this. So the structure of this problem is that it's possible, as a result of this opening facilities, it's possible that some of the customers would have an extra expected disutility cost, just because the customer preference is something that we do not necessarily accommodate in the original model. Then if you're having a large disparity in the disutility cost, then you may want to control that as a central planner to make sure the disparity is being controlled. The way that we are looking at this to make sure there is an equity in the service deprivation in our system, we are looking at Gini index, which is a measure it's an economic measure that initially was introduced in the social welfare literature for measuring the income inequities. So it's a measure that is between 0 and 1. I'm not going into detail of that, but 0 means perfect equity, and 1 means perfect inequity. So if you're having 1, that means you are not being equitable at all. So we consider the central planner would have some sort of inequity tolerance, epsilon, that would want to ensure that the level of equity in the expected service deprivation is not exceeding. So going to some results, we plot the total cost and the expected disutility cost. And in the first case, we have no equity is enforced, which means epsilon is 1. And then the total cost is shown under disutility. But then as we enforce the equity, what's happening is interesting. So the total cost is increasing, which was expected. But then we see the median of the disutility cost is also increasing. That means as a result of promoting equity, we are making the service worse for everyone, which is not very acceptable when you want to promote equity, right? So that brings us to the last case where you want to enforce that level of equity, but you want to make sure a certain number of facilities are being open to make sure a certain service level is being respected. Then that level is considered 6 in this instance, which is the optimal number of open facilities in case 1 where there is no equity. Then in this case, we see that the total cost is further increased, but then the median disutility cost is decreased. So this is just to show you what are those potential solutions and outcomes that we could get from such an optimization model that incorporates the failure probability as a result of that risk assessment step, and also the customer preference order, accommodating it or not as a central planner. That brings me to the end of this presentation. Thank you very much all.